Today's hot topic is how to get off insulin. I got this question just a few weeks ago in my free webinar where there's a chat where you can leave questions for me. And I saw it pop up and I was like, oh my goodness, this is such an important question and issue for so many people because more than half of American adults now have either prediabetes or type 2 diabetes. So the question was, my doctor just put me on insulin. How do I get off? And so this is, like I said, a very, very important question to ask and a topic to look at. Now, there are many episodes that focus around this, but I wanted to do this hot topic episode and just focus on this one question. First things first, this is not medical advice. I, as a registered dietitian, I cannot directly write prescriptions for you to reduce your medications, reduce your need for insulin, and actually prescribe different medications. I can help you implement the lifestyle that will drastically cut insulin and the need for medications and do this pretty quickly. But you need, again, this is not medical advice. You need to talk with your practitioner who, writes the prescriptions, manages your case, manages your health. And I do want to say this, if you are working with a practitioner who is adamant that this disease process is progressive and is not reversible, I would strongly encourage you to find a new practitioner who does believe you can reverse the type 2 diabetes and pre-diabetes disease process, because you absolutely can. It's a problem of glucose access, basically glucose toxicity and insulin resistance. So if we can resolve those issues, the type 2 diabetes and prediabetes goes away. Now, I do want to make it clear that this is not the same as type 1 diabetes, right? Like type 1 diabetes, there are problems with the pancreas, or the pancreas is not working, or it's not working very efficiently at all. And you need exogenous insulin forever, because that insulin sensitivity is not necessarily going to be restored. But I will say this, I do work with many type 1 diabetics as well. And if they implement the lifestyle that I teach them, the need for insulin decreases significantly. So even though you may not be able to completely, get rid of insulin as a type 1 diabetic, because again, your pancreas is faulty, you can reduce how much you are dosing with lifestyle, with nutrition. So again, make sure you're having a conversation with your healthcare practitioner, and if they are not willing to work with you to reduce medication, they have the old school thinking that prediabetes and type 2 diabetes are just going to keep progressing and that you're just going to need more and more insulin. Find somebody who will work with you. And inside my courses, if you have a doctor or a practitioner who is willing to try it, inside my courses, I do offer a PDF download where it will help your practitioner, your provider, to start to reduce medications and start to reduce insulin. And it guides them through the process with how to do so. Because I myself, as a registered dietitian, can't do that myself. I can certainly collaborate with other health professionals, but I don't write prescriptions. That is beyond my realm. So I do have guidance for you inside my courses. And of course, if you are a student of mine, I can help you even further inside my courses and through group coaching in Low Insulin Academy. And I will soon as I can get it ready and offered and all set up, I'm going to be offering group coaching monthly with me for those who are interested. And that I'm hoping to have ready by November. but that will be a new service offered. I don't have the bandwidth to do personalized consults anymore, but I will be able to do group coaching. So that is another way you'll be able to work with me very soon. So I do want to say too, so we need to think about what's happening with prediabetes and type 2 diabetes. And if you're a longtime listener of this podcast, you have heard me say this over and over. It's basically an access issue. Your insulin levels are high and your cells are resistant to that insulin. So insulin shuttles energy into the cell, right? It's like we don't just eat and poof, everything is magical and our cells just work the way they should. No, it's like insulin needs to take the blood sugar and shuttle it into the cells. And if your cells are resistant to that process, the blood sugar just hangs out in the bloodstream and you get higher levels of blood sugar and glucose. And then the pancreas just pushes out more insulin. And it's this huge vicious cycle that seems unending. And when you have high insulin and insulin resistance, you're hungry all the time. You have a lot of symptoms. You store fat very, very easily because that is what insulin is telling your body to do, is to store more energy, but the cells are all full already of carbohydrates. So then the body must convert it to fat. And it's just this awful thing. So if we look at the current American, I always want to say dietetic because that's field, but the American Diabetes Association and their guidelines. I'm basically going to tell you to do the opposite of that. Because those guidelines, if you go directly to their website, or if you've worked with, a diabetes educator, which I don't want to downplay the education that they've received, because I, as a registered dietitian, had to go through a lot of schooling. I had to get my dietetics degree. I then had to do another internship. And then if you want to be a diabetes educator, you have to work with patients for many, many hours to get that certification. So I don't want to downplay that. These people are very knowledgeable. It's just they've been trained in a way that is in direct conflict as to how you are going to actually come off diabetes and resolve your disease. So the American Diabetes Association basically, says this disease is progressive and you need to dose your medications with carbohydrate intake, where I believe this disease is reversible. And if we take away the culprit of the disease, which is glucose toxicity, you can actually reverse this whole process and heal. So if we go to the American Diabetes Association website, or if you go to a diabetes educator, you are likely going to be told as a diabetic that you need to eat carbs very often throughout the day. A lot of times you're recommended to take in 30 to 45, maybe even 45 to 60 grams of carbohydrate at every meal, and then another 15 grams of carbohydrate as snacks, and maybe even before you go to bed. This is crazy advice. The diabetes industry makes a ton of money on medications and insulin. Those of you who are on insulin know that it is very, very expensive. And so this whole message of you need to eat carbohydrate throughout the day and dose your medication and insulin accordingly has just been perpetuated over the course of many decades. And it's gotten us into the sick state where we are now. And so I'm going to tell you basically to ignore the guidelines. Again, this is not medical advice, but that 45 to 60 grams of carb at every meal, maybe 30, and then dosing snacks in there is just going to make you sicker, because it's just going to drive up, even if it's whole carbohydrates, right? So a professional who you worked with diabetes told you to eat whole grains, like switch from white rice to brown rice, and switch from, packaged oatmeal to steel cut oats. And while that might negate your blood sugar spike a tiny bit, or it might prevent it from happening for a few minutes, these whole grains all have a significant blood sugar spike when you eat them. And a lot of people don't like to hear that. They're like, oh, well, I need to eat my oatmeal every morning. Oats, whether they're steel cut, whether they're, more processed, they're still going to cause a pretty significant blood sugar spike for just about everyone. So we need to think about what is happening with prediabetes and type 2 diabetes, why that disease has developed, and then we do the opposite in order to get rid of and resolve the disease, because you can resolve it. So we need to eat all of these whole grains, and we need to eat all these fruits and vegetables. I'm not saying those are bad, but to eat them in the amounts that are recommended of 55 to 65% of our intake coming from carbohydrates is just absurd. When you have glucose toxicity, when you cannot access the glucose that is in your bloodstream, when your cells are not able to access it. So we need to do the opposite of what gets us sick, right? Because we're not shuttling glucose into the cells. We've gone so long with eating so many carbohydrates, and this has been used as our main fuel, that now our insulin levels are high and we're resistant to that whole metabolic process. So it's a good thing that we have a backup energy system in the form of ketosis and burning ketones. So a lot of times people get very confused about this. Well, how come like I can't eat a sweet potato ever again? Or I can't, I saw you eating an apple on your Instagram story. I thought apples were bad. It's like there's no I don't like classifying foods as good or bad, but you want to think of insulin resistance as being on a spectrum. And some people are just kind of beginning to get that slight insulin resistance. They're growing less sensitive to glucose. They might just be starting to gain some weight. And then we have those folks who are on loads of insulin, type 2 diabetes for many, many years. Those are very, very sick people, very resistant to glucose. Okay. Those are the people who are always hungry, always gaining weight. And so when you're a type 2 diabetic, or sometimes even a type 1, if you've grown insulin resistant, or a pre-diabetic, you have trouble losing weight because your insulin is high. And so you go to your doctor's office, they might send you to a diabetes educator, which is going to tell you guidelines that are the complete opposite of what you should be doing. They're going to say, hey, lose weight and exercise, and your diabetes can get better. Well, who's going to lose weight when their insulin levels are so high? Or if you continually are increasing the dose of insulin for a diabetic patient, it is the absolute most insane thing. It's crazy when you think about what is happening in the disease process, that we're handling it and treating it in the conventional system in such a backward way. So in my course, Low Insulin Academy, I teach you about how to bring down insulin levels through a big variety of lifestyle interventions, because this disease, type 2 diabetes, prediabetes, is a lifestyle disease that's treated with lifestyle modification. And so when we think about what is happening in the disease process, we can say, okay, if this is a disease of glucose toxicity and my body cannot utilize this glucose and it's hanging out in my bloodstream and I can't use it, and then if my blood sugar goes too high, that's toxic for my body. So then I need to do something with this. I need to convert it into fat. No, my cells are full of fat. My liver is getting full of fat. We need to take away the glucose. I mean, it's really that easy. And I shouldn't say easy. It's a simple concept. It's not easy to do. Our environment makes it difficult, right? Our food environment, our grocery stores, the fast food, the restaurants, us getting the wrong messages and wrong nutrition messages and believing that we need all this carbohydrate, when there are 3 macronutrients: carb, protein, and fat. Carbs are the only one that are not essential for humans. You could never eat carbs again and live. That's not true with protein and fatty acids. You need those in order to survive. And so I'm not saying to go and eat no carb or that they're all inherently evil, but the simple fact that we are told to eat the vast majority of our food intake from carbohydrate, the one macronutrient that is not essential for humans, is not good information. It's just gotten us so sick and fat. So we need to take the glucose away, at least for a time. And the sicker you are, the more insulin you're on, the more medications you are on, the more extreme this needs to be for a while. Because like I said, this is on a spectrum. So if you are type 2 diabetic on loads of insulin, you really wanted to keep that glucose minimal, teach your body how to start burning fat, let your body start to restore insulin sensitivity. So what that means is when you restore insulin sensitivity, you start to reverse the insulin resistance process, and then your body is able to utilize carbohydrate. You basically, when you have diabetes and you're on insulin, you have broken machinery. You have broken metabolic machinery. You are, toxic when you eat glucose. It spikes your blood sugar. So if we take it away, and this is therapeutic, right? This is a therapy to reverse your type 2 diabetes, you will start to resolve that disease process. Now, you might be thinking, well, how long does this take? I mean, I know of people who have really, focused on what they need to do, and they've reversed their disease process in 3 to 4 months, with more, a little bit longer fasting and keeping their carbs really minimal. They reverse the process. They become, sensitive to carbohydrates again, and then they can afford to start increasing carbohydrates a little bit. We don't want to go back to eating the 50 to 60% carbohydrate that we were eating before, because we'll just get insulin resistant and get sick again. So we need that therapeutic carb restriction is super important when you have type 2 diabetes and prediabetes, because it allows your body to start to access a different fueling system. Whether or not it's dietary fat that you're eating, the healthy fat, remember, we don't want to eat inflammatory seed oils. We want to focus on the really healthful fats, whether it's from the fat that you're eating or you're burning off fat that you ate over the last 50 years. It's stored in your abdomen and your butt and your thighs. That is going to, your body's going to start utilizing that and say, oh, wow, I have all this fat access. Once you get the insulin out of the way and you stop your body from wanting to store energy, store glucose, store fat all the time, you get that insulin out of the way and your body can access other fuel. And like I said, it's either dietary fat that you're eating, or it's stored fat, depending on if you're adding in intermittent fasting or longer fast. So another thing that's super important to think about, not only just carbohydrate intake and nutrition, and like I said, the guidelines are very confusing, and you would think these people with a lot of training and years of working with diabetic patients would have better results. But I know when I was a registered dietitian in the conventional field, I was not taking people off. Again, I myself I wasn't helping people to come off medication and to come off insulin. They were just having to need more medication, more insulin, despite, following the crappy conventional guidelines that I was teaching them. And so when you actually do the opposite, and it's really sad that is what the case is, but people are wising up. People are sick of being sick and fat, and they are looking for solutions. And when you actually think about what's happening in the body and doing the opposite to undo it, it makes a whole lot more sense. So back to strength training and exercise. This isn't a really important part of it with recovering from type 2 diabetes and prediabetes, fatty liver, all the metabolic diseases. But the question was specifically, how do I come off insulin? So nutrition is a huge part of it. But the other thing is we really need to work on increasing muscle mass. So once we get the foundations of nutrition, and you might be thinking, well, where do I start with carbohydrates? How low do I go? And Low Insulin Academy is the best source for this. You can either do my on-demand version or the next live version. The enrollment starts January 2nd of 2024, and there is a link in the show notes for the wait list. So you can get the enrollment information as soon as it opens. You also get a discount that way, but Low Insulin Academy goes through all of this. And then I also have a carb quiz that is linked in the show notes that can help you. But I'm generally recommending, and this is where working with me individually inside my course or in group coaching, I can help you further. So generally, I'm recommending anywhere from about 20 to 25 grams of carbohydrate daily for those people who are very ill and on that high end of the insulin resistance spectrum, because you are not processing carbohydrates. We don't want to put a lot of in, up into about 100, maybe even 150 for men who are very active and insulin sensitive. But I myself, I usually am still under 100 grams of carbohydrate daily, even though I have restored my insulin sensitivity and reversed my own insulin resistance, because I was insulin resistant despite being at a healthy weight and always having normal, healthy blood sugar levels. So that is kind of the spectrum of carbohydrate, but taking my quiz can help you to actually figure out where to start. So that is, a little bit more guidance on where to start with carbohydrates, but then the exercise is super important also, because this allows you to burn up the carbohydrate that you are eating and restore the insulin sensitivity and have more disposal for glucose. I hope that makes sense. We dispose of the glucose in our bloodstream, in our muscle skeletal tissue. That's where the majority of it goes. And also in our liver, in the form of glycogen. That glycogen is stored glucose. So again, most of it's stored in the skeletal muscle, but there's also a small amount stored in the liver. And this is mainly so when you go to sleep overnight, your liver can dump a little bit of carb into your bloodstream. And when you exercise, your muscles can dump some carb into the bloodstream in order for the muscles to utilize it. So if you have more muscle mass, you have more space for carb storage. Okay. Think like I've talked about it as like little buckets all over the place where you can just dispose of glucose that you eat and store it for later. Or you can think of it as like a big sink that kind of fills and drains and fills and drains depending on your activity, depending on how much carb you're eating. So if you're eating a ton of carbs all the time, you're going to fill up that sink every single day, especially if you're not exercising, you're not strength training, you're not burning off the glucose that's stored, because you can only store a finite amount. This is not endless storage. If it were, we would not have any weight issues. We would not have any glucose issues because we could just keep storing it. We can only store so much. Once the capacity is full, your sink is full, and you keep eating more carbohydrates and you're not exercising, you can't drain the sink. Okay. So that's where exercise and strength training helps to drain the sink. And then strength training, adding more muscle mass, helps to make your sink bigger. So when you do eat carbohydrates, you can dump more in there. You can fill it higher. Okay. So when we exercise, and especially I talk a lot about walking after you eat a meal. And the reason why I love that, exercise is awesome anytime, anytime we're more active, and exercising before a meal, there's benefits to that as well, because you'll burn through some of those carbohydrate stores. So then when you eat, you can dump more in. But the advantage to walking after a meal within about 70 to 90 minutes, and I've really started focusing on walking after a meal for at least 10 or 15 minutes whenever possible. We're going into colder weather here in Wisconsin, but I have a treadmill desk in my office and I hop on that every couple of hours while I'm working if I can't get outside. But the reason why this is so beneficial is after you eat a meal, it's breaking down, your glucose is starting to rise. You know this if you've worn a continuous glucose monitor or ever tested your blood sugar. That's natural. Your blood sugar is going to rise. We want to keep that minimal. We don't want to have these big spikes, but blood sugar is going to rise. If you exercise after your meal, as your blood sugar is rising, before it hits its peak, and even after it hits the peak, you're going to pull the glucose out of the bloodstream. Your muscles are going to need it for energy. They're going to burn that up. The reason why this is so important is because then you don't have to secrete insulin in order to shuttle the energy into the cell. Okay. So it's less insulin that your body needs to release. That is so super important to grasp. So even though there's, again, much benefit to exercising any time of the day, you can have better, more glycogen storage when you've exercised before a meal. Your sink is going to be emptier, so you can dump more glucose back into it. But the advantage to doing it within 70 minutes is the best. Like if you can do a short, even 5 to 10 minute walk or any kind of exercise, squats, strength, whatever you're doing, within 70 to 90 minutes after you eat a meal, then you don't need to release as much insulin. This is so important for those people trying to reverse their insulin resistance. Because if you have insulin resistance and high levels of insulin, we're trying to negate how much insulin your pancreas has to put out, right? Like that's how we reverse insulin resistance. We bring insulin levels down. So if you can get some walking in after a meal, especially if you've eaten more carbohydrates than intended, you can negate the need for as much insulin as if you just went and sat down and did nothing. And even standing is more beneficial than just sitting after a meal. If you have a standing work desk or something and you just can't get away from work or whatever it is, even if you just do some calf raises while you're sitting there, that's going to be helpful. So those are the main things that we do to reduce the need for insulin. So again, if you go to the conventional system, they're going to say, just sorry, your disease just progressed to the point of needing insulin, and now you're going to be on insulin for the rest of your life, and we're probably going to have to increase it, and all of these, you're gonna start to have more and more issues, and we really need to manage this so that you don't need to go and get dialysis and lose your fingers and toes and you start to go blind. And it does not have to be that way. It does not. You do need to do the work and wrap your whole mindset around the fact that this disease is reversible, and this is what I need to do in order to do it. I need to stop going to fast food. I need to eat at home the vast majority of the time, so I know exactly what's going into my body. I need to reduce my carbohydrate intake until I get this disease process reversed. And it might be hard for a while. I might need to implement intermittent fasting and do some longer fasts if my insulin resistance is very stubborn. Now, and I wouldn't recommend doing that for several weeks, those longer fasts, because you need to let your insulin levels come down so you're not so hungry and feeling so out of control for a while. So first we reduce the carbohydrates, increase the protein and fat, then we can add some intermittent fasting and possibly some longer fasts under some guidance later. And then we need to be more active and think about how we're going to reduce that glucose so that we can reduce the need for insulin. This can be done, even if you're on, I know of people who are 300 units of insulin a day who have come off of it within months. But you have to wrap your head around the fact that this can be done, and you have to wrap your head around the how you're going to do it and how it is achieved. Okay. Simple concepts, not easy to do. You need some help with it. You might need to talk with those around you in order to have support. If this is something you're doing with your family, talk with your family, implement it together. These strategies, while somebody, eating lower carb and exercising, all of the things that I'm talking about, even if you don't have prediabetes or diabetes, it's going to help you not to develop them. So there's no reason why the whole family can't do these methods together. Of course, if you have children and that sort of thing, you're not going to have them do long fasts or any of that sort of thing, but they can certainly eat lower carb and focus on protein and fat, not be snacking excessively, not be having sugary foods, and just learn how their whole metabolism works. So type 2 diabetes is an access issue. You can't access fat. It's broken metabolic machinery. You're basically carb toxic. You got to take away the carbs for a while. Get your body used to being metabolically flexible, restore the metabolic sensitivity or the insulin sensitivity, get that pancreas working better, get the cells more. I shouldn't say the pancreas. The pancreas is likely fine. It's just pushing out too much insulin. Got to get those cells metabolically healthy and sensitive again. Seed oils need to come out as well. So I know that this is a packed episode, but this is how you come off insulin and that you reverse the type 2 diabetes process. Again, not medical advice. Please have a conversation with your practitioner if you want to do this whole process. I would very highly encourage you to do so. If they're not willing to work with you, find a new provider, because there are plenty out there who believe in this and believe in reversing the whole disease process, and many of them will work with you virtually. I can help you inside my courses to implement all of these strategies together. Get on the wait list for Low Insulin Academy Live if you want my individual support and group coaching weekly. The next round starts January 2nd. See you back next week for another episode.